So look, we'll get going now. Thanks to everyone for making the time to connect to this Zoom seminar this afternoon, not a face-to-face seminar. But before we begin today, I'd like to acknowledge and pay respect to the traditional owners of the land on which we meet, the Widjabul people of the Bundjalung Nation. And I repay my respect to elders past and present, and I extend that respect to any Indigenous people who are present today. I'd like to remind participants in this Zoom seminar if they can keep your microphone muted. The seminar's being video, audio recorded, and we'll have questions at the end of the presentations. So this seminar is a little bit different. We're going to have 3 related presentations, around 15 minutes each, with some questions at the end. And I assume we'll do the questions at the end of everyone's presentation rather than in between the presentations. What do you think, Jeff?
Yeah, I think that'd be best.
Great. And so today's presentation is around identifying the health impacts of climate change, adaptation strategies and responses among Aboriginal communities in New South Wales. And our presenters today are Ms. Jess Spencer, a proud Wiradjuri woman from the central west of New South Wales. She's an Environmental Health Project Officer at the Aboriginal Health Unit of the New South Wales Health Department. And Jess is responsible for delivering environmental health initiatives at the grassroots level, while translating outcomes from these initiatives and other observations from the field into evidence-based policy at the state level. But you're going to have to wait a minute for Jess. She'll be presenting after our first presenter, Jeff Standen, who's the manager of the Environmental Health Unit at New South Wales Health. Under Jeff's guidance, unit has trained more than 17 Aboriginal people into professional roles with degree qualifications and delivered and evaluated projects to improve housing for over 4,000 families in Aboriginal communities across the state. And this work's been demonstrated to reduce hospitalisations for a range of health conditions. The unit that Jeff directs has also established a multi-million-dollar cross-agency partnership to improve environmental health infrastructure in Aboriginal communities. So I'll turn over to Jeff now and welcome. And I should also mention that that we'll also have another presenter, Veronica Matthews, that will be presenting later in the session. Jeff.
Okay, thanks everyone. I'm just going to share my, can you see the PowerPoint presentation?
Yeah, that's great.
Can you see just the full screen version?
Yep, perfect.
Okay, great, all right. Thanks everyone. So today we're going to talk about a project we ran with Sydney University, identifying the health impacts of climate change and looking at adaptation strategies and responses among Aboriginal communities in New South Wales. Jeff and Jess, sorry, myself and Jess are going to present it, but we worked very closely with a number of people at Sydney University at the Human Health and Social Impacts Node, including Jeff Morgan, who's with us today. And they did a lot of work behind the scenes. Jess and I are just, too many J's. Jess and I are just presenting the work here today. So what the project was about, I suppose I should also just mention that the Human Health and Social Impacts Node was set up at Sydney University. It was funded by the Department of Primary Industries and Environment, and it has done some previous work looking at environmental health indicators, being those indicators that illustrate the impact of environmental health on environmental hazards on health.
Sorry, Jeff, can I just butt in for a sec? Your mic's sure. Just dropping in and out a bit. I'm not sure whether you're running off the laptop mic or the...
Okay, I think
headset.
I'm running off the headset. So
Yeah, that's right. It may be necessary just to be a bit closer to
the
the
mic.
computer.
Sometimes it drops away from my mouth there. And what we wanted to do was to look. We've done some work around what the impacts of climate change are, and we wanted to look more closely at how this might impact Aboriginal communities. So we worked with Sydney University, but we also had on board with us the Aboriginal Health and Medical Research Council and Aboriginal Affairs New South Wales, and the Centre for Aboriginal Health in New South Wales Health as well. So the project, and it was really meant to be the first stage of a project that aims to identify what do we already know about climate change from the science and the modelling. What do we know already about Aboriginal population demographics? How will Aboriginal people be exposed to climate hazards in different areas across New South Wales? And to start some discussions around and consultations of what this will actually mean for Aboriginal communities, and what do we need to start doing now. There is a second stage to the project that was proposed to consult more deeply, and our consultations were limited by COVID. Obviously couldn't get out and about. So the second stage, Veronica's going to talk a bit more about that, where we're partnering with her around some further work. The project had a couple of some underlying principles, and that was really to acknowledge the Aboriginal concept of health being a sort of environmental, cultural, historical, and sort of spiritual health, as well as not just physical health, and acknowledge those key cultural determinants such as connection to family, country, kinship, and its importance in health. We also acknowledge that Aboriginal people, Aboriginal communities have knowledge on climate and health that's sort of been developed over many thousands of years and may inform our project. And as I mentioned earlier, we're a little limited in our consultations because of COVID, and so this is only sort of really the first part of a longer project. In terms of what we did, we looked at what we knew, so we were able to get environmental exposure data, such as the Australian Water Availability Project data, and NARCLIM, which is the New South Wales and ACT regional climate modelling data, projection data to inform us. We used population-weighted estimates, which calculated at the statistical area 1 level from the ABS population grid 2016. And the statistical area 1 level estimates were categorised, and overall proportions of Aboriginal versus non-Aboriginal people in those areas were calculated using usual resident populations. And we found that this map shows the estimated the proportion of Aboriginal and non-Aboriginal people across New South Wales, and you can see that in terms of the map shows the number of Aboriginal people and in the various locations, and down here in the chart, the bars here shows that Aboriginal people, most Aboriginal people in New South Wales tend to live in major cities, but proportionately more Aboriginal people live in the regional and remote areas compared to non-Aboriginal people. There are some discrete communities, Aboriginal communities around New South Wales. There's about 60, and they're represented by the triangles, little red triangles. And you can see that they generally tend to be more common along the north and west of the state. And most of those discrete Aboriginal communities are on rivers and floodplains. This is some of what the data tells us that we know from projections into the near future, which is the next 20 years, and the far future, the following years after that, decades after that. And what we can see is that I'm just getting at this, is that the number of hot days is predicted to increase by up to 40 days. So The blue box there shows that the number of hot days per year above 35 degrees in inland New South Wales will increase into the far future. So currently, northwestern New South Wales experiences around 60 days a year over 35 degrees Celsius. And so by 2060, this is projected to increase by 40 days, so that'll in spring and summer, so that'll make a 100 days, and nearly 1/3 of the year is going to be over 35 degrees Celsius. And Jess is going to talk more about how that might impact Aboriginal people, but in terms of clearly people have to have the ability to adapt through to those changes in climate. And heat waves will also increase in frequency and duration across New South Wales. The brown box shows that extreme heat will result in increased fire weather as well, especially in Western New South Wales in spring and summer. And down the bottom, rainfall is going to increase or decrease depending on where you are in the time of the year. And as I mentioned earlier, that that if communities are located on rivers and floodplains, that may have a particular impact on them. Climate, so I mentioned climate hazards such as floods, heat waves, droughts, are projected to become more frequent and intense. Socially and economically disadvantaged groups, including Aboriginal people, will be disproportionately affected. And there's adaptation responses require an understanding of climate on health and Aboriginal people. Human health can be impacted by climate in three main ways. So either directly or primary harm, directly through heat waves, floods and bushfires. Indirectly through altered environments and ecological systems, so increased mosquito breeding and vectors, changing Q fever, changing waterways, or they can actually be referred to through referred harm, which is sort of its impact on mental health and social wellbeing. And Jess will talk about some of this as well. Our current research focuses on the current research available tends to focus on those primary impacts. So, and there's limited assessment of indirect and referred harms such as ecosystem changes and food insecurity and mental health. Most of the research focuses on the primary factors. And as I mentioned, that Aboriginal populations are going to be disproportionately affected by the adverse impacts of health, but there's few studies examining these relationships using New South Wales data that's available. Heat related illness can really include anything from sunburn through to dehydration, heat cramps, heat stroke and death. It's often identified in the data, in the health data, as a secondary cause of death. And those people at highest risk are generally babies and infants, elderly, people with cardiovascular disease and other chronic and acute illnesses, mental illnesses, medications and drugs, people who can't, lack of acclimatisation. Now that has come from studies where people have moved to particularly hot areas, or like they've ridden a push bike across the Simpson Desert or something, but also people working, exercise and playing sport in hot environments are a high risk factor, and being able to access somewhere cool during a heat wave has been showed a very positive effect. So if you can't do that, if you don't have air conditioning or air cooling in your house and you can't access a cool location, and if you live in many Western towns, there isn't a cinema or a shopping centre where you can visit on a really hot day to escape the heat. Sorry, this shows repeated. This is some of the other findings that we found in terms of heat and Aboriginal populations. Was that the map here on the left shows that the number of days above 35 degrees Celsius over the past 20 years, and on average 20% of Aboriginal people live in areas with more than 20 days over 35 degrees annually, compared to 5% of non-Aboriginal people living in these areas. Poverty can have an impact on people too, and their ability to change or regulate their environment, to air condition their environment, may be a factor as well we need to consider. And this graph on the right shows that it indicates the predicted additional days over 35 degrees Celsius. So whilst everywhere will get hotter, the hottest places currently will be the most impacted. And again, that's impacting a higher proportion of Aboriginal people in those areas, as you can see down the bottom here. The next slide shows the number of, shows again that a larger proportion of Aboriginal people to the non-Aboriginal people reside in areas that are going to experience higher rainfall variability. So 13% of the total Aboriginal population living in areas with moderate to high to very high rainfall variability, compared to about 3% of non-Aboriginal people living in these areas. And again, rainfall variability is projected to change even more in the next 20 years, with Aboriginal people being affected by either more, greater or less rainfall, depending on their location. And, you know, that's might not just be an issue about being prepared for floods, but it could impact water quality, cultural activities, food sources, etc. in times of drought. And in terms of drought, we found that in the last 10 years, Aboriginal people have already been more affected by drought, and they're more than twice as likely to live in areas with increased drought compared to non-Aboriginal people. And some of these areas in the light and dark brown on this map here are predicted to experience more months in drought. So some of the things that we found from the study was that, just in summing up, is that there were gaps in the literature and the data that we really need to understand the impact on health and what the best adaptation strategies would be in areas like extreme weather events and emergency responses, so those heat waves, the floods, the fires, but also in areas like housing, and we need to work with the relevant agencies and stakeholders to look at current guidelines and policies that will support better health in the face of a changing climate. So, you know, is air conditioning available? Can people afford it? How can they, you know, look at doing it with perhaps solar PV, so that it's people can have access to cool environments without breaking the bank. Also, we're looking at issues around water and water quality and water management, vector-borne diseases, air quality, particularly with dust and bushfires, and Jess will talk more about this, and also issues around food security. So, and you know, whether people actually have the capacity in their homes to prepare, cook and store foods, you know. So on that note, I'm going to hand over to Jess, who's going to give us some case studies from some preliminary consultations that we've done that have sort of identified 3 main areas where the need exists that will likely be exacerbated by climate change. So Jess, over to you.
Thanks, Jeff. Next slide. So today I'm going to paint the picture on the importance of these 3 key areas: connection to country, water and housing sustainability for Aboriginal people in the face of climate change. Starting with connection to country, thinking about the 2019 and 2020 dust storms, and there were so many of them, most of them, or some of them, affected the entire state. If you lived in the metro areas of Sydney or on the Central Coast, you were given days of media warning that the dust storm was coming. But if you lived in the west of the state, there wasn't really a lot of public health messaging. And if there was, it probably wasn't suitable. I'd like you to think of being an Aboriginal mum looking out her window, seeing another dust storm coming. Her house is probably already messy, full and overcrowded with lots of extended family. She doesn't just see the dust, she sees the cleaning, the gap under the door, which is huge, and she's seen mice and snake already come in. The windows probably don't close or seal off well, and I know this from a program delivered by New South Wales Health called Housing for Health. It's got years of data on broken windows. Besides, it might be too hot in the house to close the window anyway, and her air conditioner, as Jeff mentioned, probably might not work, and if she can afford the cost of running it, The windows just make it not function properly anyway. She could also be stressed about the expense and logistics of Ventolin for asthmatic kids or relatives. She may not have a car, the pharmacy might not be open, there couldn't be any money. She may not want to go to the clinic for whatever reason, small town gossip stuff. And her only option to avoid the dust might be to go to a local club or hotel or the only air-conditioned social building in town. There's no Westfields in Wilkenya. If she lives in the west of the state, say Broken Hill, her concern could be about the health effects of lead, or maybe it's just the price of the cleaning products at the local store. She could be concerned that there's no work for her man, and she thinks that the dust means no crops, no feed for livestock, job opportunities are lost. And as we know, many Aboriginal people in regional areas rely on the seasonal work, the harvest, the fruit picking for employment. Change in the climate means the work's less and they're more likely to move to other areas for employment opportunities. So I want everyone to think about the Closing the Gap target to increase the proportion of Aboriginal and Torres Strait Islander people aged 25 to 64 to be employed to 62% by 2031. The jobs aren't there now. They're not going to be there in 2031. So one example is looking at Moree in the cotton industry, where hundreds of people used to be employed for chipping annually, and now there's very few. Next slide, Jeff. So on this side, I've got a picture of a house with some roos, and they've moved in close to town for food sources. Think about what it's like looking out the window and seeing your natural environment move in. With more variations, more hot days in temperature, people are probably more inclined to share their immediate living environment with domestic animals, with cats and dogs, and sometimes with the native animals. These roos are all visiting this house because it's got lovely green grass. I want people to think about, how some people may feel obligated to feed and water these native animals when they see them in such distress. And this can lead to other public health issues, such as zoonotic and arboviral diseases. I had my own personal experience when I took this photo. These roos scared me on my morning walk and discouraged me from physical activity the following morning. And what about the river and the other picture? This is the Namoi River at Walgett. And as Jeff mentioned, most of the discrete communities are formed on the rivers. What cultural activities are lost when the flows stopped? The river is life. It brings recreation and a place to cool, a place to gather, relax. It grows food sources, fish, yabbies, native animals, plant species, that are all often eaten and used to supplement diet and food insecurities in these areas. The river also allows for swimming and fishing, lots of physical activity, and it brings tourism and job opportunities. Next slide. So consider the impact of the recent fish kills on the Aboriginal people's health and well-being. Between December 2018 and January 2019, there were 3 mass fish kills in the Lower Darling. This loss resulting in loss of tourism, loss of natural food resources, and loss of recreational time, a result of our changing climate. Next slide, please. And there's been lots of talks about rivers in my travels delivering different environmental health interventions. Some communities blame drought, others blame policy, the state government's policy to allow people upstream to draw from the river before others downstream see it overflow their algal bloomed weirs. Some communities are still forced to stay on salty, unpalatable bore water as their drinking source. And in some areas where we know there are high Aboriginal populations, the ageing water treatment plants are struggling to produce safe drinking water because of the turbidity of the supply that they are now getting from the river. Sometimes there are repeated boil water alerts, and in some places the community stop drinking the water because it smells and tastes horrible, and they stop wanting to bathe in the same slimy, smelly water. There is a concern in some places that consumption of salty bore water will add to an already high salt diet intake, therefore compounding chronic health issues. In one community, we tested some rainwater tanks. Now, these are possibly a fantastic adaptation strategy as an alternative drinking water source if they were maintained properly. We tested these tanks and all but 1 out of, say, 20 were positive for E. coli. showing that this type of infrastructure might be a great idea, but housing departments, housing providers, community housing providers and health departments need to work together to ensure that the infrastructure is safely doing what it was intended to do. The responsibility for maintaining the infrastructure needs to be clear. They need to be placed on regular and frequent repair and maintenance programs. Everyone knows that the rainwater tanks will breed mosquitoes, and looking in some at the moment, there are a lot of mice. The other pictures are wasted water, and they're pictures from our water and sewage program in New South Wales, Aboriginal Communities Water and Sewage Program. One of them is a break in of the main water main into the house. As we know, water is the valued commodity here, but we also know that a lot of people in community are not reporting water leaks because they want to support struggling, thirsty wildlife. They want to see green patches. They want to suppress the dust. And unfortunately, this break in the line makes the water very unsafe, really unsafe if they're attracting wildlife to the area, and could potentially make people unwell. So somehow we need to illustrate that we need to consider cultural obligation to country when feeding and watering animals without risk to public health. Next slide. The next pictures are of stormwater. This is ponding stormwater inside a levee bank in one of our discrete communities. And as Jeff mentioned, our data found that there's going to be more intense rainfalls, but they're going to be less frequent. So the ground's going to be harder, and perhaps the water will sit for longer in some locations, particularly in this location. So this problem here is caused by broken infrastructure, a stormwater pump, and this means that the water sits stagnant. The kids, the dogs, the mozzies, everyone gets to play in the same water. And unfortunately, it's got potential for disease, and it's also got potential to damage the infrastructure permanently and some of the housing foundations nearby. Don't know if you can see on the picture on the right, there is a pathway leading towards the swing set. Well, there's actually a clothesline there. So, you know, the pathway is missing and will become a trip hazard for the elderly resident that lives there in the future. Next slide, please. So then there's the effect that the poor water quality has on our housing infrastructure, like this evaporative air conditioner. It creates a build-up on the filters, potentially making the air conditioner not work properly. Few studies have shown that these type of air conditioners may not suitably decrease the air temperature in some houses anyway. These swampies don't cool a great deal on a 44 or 48 degree day. So even if you are at home running your aircon and your windows do close properly and you do have adequate ventilation to run it, you may still be sitting in around 34 degrees. And with aging infrastructure of the house, you know, we could look at other issues around insulation in ceilings and walls for heating and cooling. So the water quality can also affect other parts of the house, such as the shower hoses, the hot water units, affecting people's abilities to wash. Can also damage our washing machines and kettles. And one should like to think about the economic cost of replacing a kettle in a remote location. Some places where they may not be available and you have to travel. The other picture here is of mould in a bathroom, and it's not a coastal house. It's actually a home in one of the driest areas of the state. So we already know about housing that some of the design and ventilation is so poor that, you know, added change to climate is going to exacerbate these issues. And the other thing with considering the closing the gap target to increase the number of people that are living in appropriately sized housing, so addressing the overcrowding issue, I don't think that it can really be met in the face of climate change unless all the houses function properly. We see a lot in acute rheumatic fever cases and other things. It's often people sharing the cost of living and residing in the one home together, or sharing space, so sharing the one room in the house that may be dry, cool or warm or lockable, so therefore creating an overcrowding issue just within a house due to the house's inability to function properly. And I've shared this picture of a pot on the stove because basically our report touched on food insecurity, which is probably a much larger issue for anyone in regional Western New South Wales that is on low income. But if you think about food insecurity, most of us often think about the availability of fresh produce and getting it home, that sort of thing. We don't necessarily think about where we're going to store it, prepare it, and how we're going to cook it. And we definitely probably don't think about the cost of running, you know, lots of fridges and chest deep freezers if we live remotely. We probably don't have to think and worry about if our oven or our stovetop works. But in this home, this house had a lot of people living in it. This big pot is probably very unsafe. And my point here is that it could have been on the back element of the stove and reduced the risk of injury if all elements on that stove had have been working. Next slide, please. So anyway, just to conclude, the health and wellbeing of Aboriginal people is already affected by climate and will be disproportionately impacted further by climate change. And as we've said, this will make closing the gap targets very difficult to achieve unless there are effective adaptation responses. We've found that, you know, all state government agencies and NGOs need to acknowledge their roles in addressing the Aboriginal health impacts of climate change, and we need to look at our own policies and programs and make sure that they're entirely relevant. And we need to engage further with Aboriginal groups on the development and implementation of Aboriginal-led adaptation strategies. Next slide, Jeff. So I also just want to say thank you to the Human Health and Social Impacts Node at Sydney Uni with Dr. Jeff Morgan and his team. And I'll leave you with this picture of the Brewarrina fish traps, which are over 40,000 years old, one of the oldest man-made structures on Earth. It's an elaborate network of rock weirs and pools which stretches around ½ a kilometre along the Barwon riverbed. It was built by Aboriginal people to catch the fish as they swam upstream. And I think it's an interesting story on how the climate changes our activities. I'll now hand over to Veronica Matthews, who's a research fellow at the University Centre of Rural Health, whose climate research has Aboriginal knowledge at the centre of any climate adaptation strategies. Thank you, and I'm sorry, I may have to leave at around 1:45, but if I'm not here, you can direct any questions to Jeff and Veronica. Thanks.
Thanks, Jess.
Thanks, Jess. I'd just like to begin by also paying respect to the traditional owners of the various lands on which we stand, and also acknowledge country as well, the land that has sustained Aboriginal and Torres Strait Islander people, our culture and spirituality for millennia, and really is fundamental to our identity and way of life. So I'd like to thank Jess and Jeff for their presentation that showed, I guess, the real and present threat from extreme climate to a healthy connection to country for many mob in New South Wales. Unfortunately, it's a story though that is currently playing out across Australia. And I'm here to briefly talk about a project idea that this team listed here on this slide has recently developed and submitted for funding. But by way of introduction, I come from Quandamooka country, Minjerribah, which is Stradbroke Island off the coast of Brisbane in Queensland. And I work, as Jess said, as a health systems researcher here at UCRH on Bundjalung country. And I co-lead the Centre for Research Excellence in Strengthening Systems for Indigenous Healthcare Equity. And an important component of Indigenous wellbeing is that connection to country. So this project is titled Healing Country, and it potentially forms the next step to the type of analysis that Jeff and Jess just presented, taking the next step to work with Aboriginal communities to integrate their traditional ecological knowledges with other data sources, and then using these multiple information sources to develop local climate change mitigation and adaptation strategies. Thanks, Jeff. So I don't think I need to go too much into the background, as Jess and Jeff have covered most of this, except to say that Aboriginal communities are currently suffering the effects of climate change across all of Australia, exacerbating existing health and social inequities. And there are international policy groups such as the UN Office for Disaster Risk Reduction and the IPCC that are emphasising that to strengthen our adaptation to climate change and community resilience, we need to undertake bottom-up, place-based, whole-of-system approaches, which involve all sectors of community, especially the marginalised sectors of community in planning and decision-making around risk. They're also increasingly recognising the value of Indigenous knowledges that have accumulated over millennia through careful observations. And to date, studies have shown that most work that is integrating Indigenous knowledge with Western knowledge systems for climate change adaptation has occurred in the Inuit areas of the Arctic region and in Africa and Asia. There has been some studies in Australia, but mostly these have occurred in remote areas of South Australia, NT and WA. However, in a recent systematic review, Australia was identified as a geographical gap in terms of utilising traditional knowledge systems for climate solutions. And it's an extremely valuable data source to be overlooked, because Aboriginal and Torres Strait Islander communities have sustainably cared for this country for thousands and thousands of years. Thanks, Jeff. So the aims of the project are to do just that. So firstly, through participatory community-based mapping, respectfully gather traditional ecological knowledges and community experiences to document from local perspectives the environmental changes that have and are occurring and the impact that this is having on Aboriginal community wellbeing. From this, we aim, again, with community to co-develop interactive online story data maps that combine those traditional knowledges and stories with environmental and health data and GIS technology. So it becomes a tool for broader knowledge exchange. And then, as I said, use these multiple information sources to bring together relevant environmental and health system stakeholders to work with community in the co-design and implementation of mitigation and adaptation strategies that are tailored to the local context of that community. So these will become the local community resilience plans. So through community consultations held to date, we have identified 3 locations that represent urban, rural and remote locations. So they're Perth, Northern Rivers in New South Wales and Tennant Creek. And by way of further examples, just adding to what Jess has already described, just through these consultations, we know that the priority issues currently being experienced by community are that they're losing their traditional food sources. They're witnessing ancient waterholes drying up. Out at Tennant, they're seeing their salt bush plants burning black in the new heat that's happened over the last few years. And the prolonged periods of excessive hot days, they're suffering through because of inadequate housing and energy security. So climate change is a pressing concern for these communities and really a further driver of Aboriginal disempowerment and subsequently poor health. So these were the locations that we have placed into the funding application. However, as Jeff mentioned very early on, we'll be looking to replicate this project as well in inland New South Wales. Thanks, Jeff. So as I mentioned, the project aims to empower local communities to tell their story and lead and control the development of these story data maps throughout all project phases. So in this first phase, local community members will gather the traditional knowledges through that mapping process. And we have an Aboriginal organisation called Winyama who are based in the Kimberley. They specialise in geotechnical work with Aboriginal communities, mapping their heritage and traditional knowledges, particularly around mining sites. So Winyama will train up local community members in each of these 3 locations to undertake the mapping with their communities. And elder groups will oversee that data collection. And these same elder groups will form the governance of the whole project. So from that first phase where we're gathering the traditional knowledges and the experiences of community, what will emerge from that are the priority needs. And this will then determine what type of environmental and health data that we'll access to form the next layer of that map. And the type of data will include, the information that Jeff presented early on: census data, meteorological, land use data, water quality and water flows, air quality, housing quality, and administrative health data. So with the help of Winyama, we will combine these geotagged community stories and the health and environmental data to form interactive online maps. So these can be used as a knowledge exchange product, but also an advocacy tool for communities, and will also become the decision support tool for local mob when working with stakeholders in government to work together to develop up their adaptation strategies that will address the priority climate and health and wellbeing risks. And we're aiming for at least one of those priority strategies to be implemented within the project timeframe, which will run over 4 years. So that's really the project idea in a nutshell. So fingers crossed that we will have a successful outcome, and it's not likely we'll find out till towards the end of the year.
Thanks, Veronica.
So I'd just like to thank Jeff and Jess and Veronica for that presentation. We've got a few minutes for questions. If anyone has any questions, they could unmute and let me know, and for the first question, but otherwise, if you can also type in questions and I can throw to you when you've typed in your question. Jeff, perhaps I can ask the first question. Have the health department been doing much work in this area of climate and health around Aboriginal communities, or what's the background there?
So New South Wales Health has been looking at the issue of climate change for everyone in New South Wales. It's been an issue that New South Wales Health has been looking at. This project that we did was really the first attempt, I suppose, to sort of say, okay, well, what does this mean for Aboriginal, like, how are Aboriginal people going to be affected? And okay, so we can see they're disproportionately going to be affected, but what does that actually mean? Because part of it will be Aboriginal people will be impacted in the same way as anyone living in those locations that get hotter or drier or wetter. But their ability to adapt to that may be different depending on their socioeconomic circumstances. So like I said earlier, if you're rich, you can afford to air condition your house or your car. But if you can't afford to air condition your house or your car, then you're going to be living in a hot place, you know. And if you don't have, if you live in an overcrowded house that's and it's kind of managed by a remote housing provider, and they're struggling to actually have the capacity to manage the houses that they manage. Things like putting air conditioning into a house is just another, from the asset management point of view, it's another liability in a sense, but it's also can present an economic impact on people living in the house because they've got to pay for it. If you're living in a hot house in Wilcannia and you've got air conditioning, you're going to run it all the time. And if it's a crowded house, it's probably going to be running all the time. Everyone's probably going to be sleeping in that one cool room. So in a sense, it'll actually impact on crowding as well, because you've got everyone living in one place. So transmission of infectious diseases can increase. but it's actually going to have an impact. Then people are going to be able to pay that bill. Jess and I actually joined a project in northwest New South Wales recently. We were talking to one lady, she had a $10,000 power bill. I thought, my God, how on earth do you pay that off if you're on Centrelink? So this is probably, to answer your question, this is sort of the first cut at what we've been looking at specifically in terms of the health impacts for Aboriginal people. Other agencies have been doing some in New South Wales government and have been looking at this. So I know that Aboriginal Affairs, who were a partner to our project, have been looking at emergency management responsiveness and preparedness for communities, and how they can, and I guess what we're doing is just sort of further informing them is that yes, these places are going to get, I mean, everyone kind of knows that these things are going to have an impact, but they are going to increase.
Great, thanks, Jeff. I see Stephen. Are you up? Is that you're wishing to ask a question there, Stephen? I'm sorry, you're on mute, Stephen. Look, what?
No, it's fine, thank you.
Okay. So Melissa has asked a question. I wonder if you'd share feelings about the challenges and that have led to the stalemates for such a long time, and can you gain hope with the knowledge of the human aspects that you're emphasising, as opposed to a focus on the buildings and hardware? So I suppose Melissa is just talking about the focus on the human component of this as a means of solution. I think Veronica highlighted that. Melissa, did you want to add anything more to that?
I just wanted to really say it's really good to hear that, because I do think it might have been not at the forefront before, and particularly hearing about Indigenous knowledges and understandings and sharing and giving people someone to hear, to talk to, someone who's interested in that voice. So yeah, not really a question, but just to say, I think that's a real step forward. That's really great to see.
Thanks, Melissa. Veronica, did you want to add in anything there?
Just to thank Melissa for her observation around that aspect of the project, and I think the frustration is there with the communities. So they have been experiencing these challenges for quite some time, and there's an elder there in Tennant Creek who is such a strong advocate for the climate change impacts on his community. But I think he's getting a bit hoarse. It's taken some time for people to listen. So hopefully through this approach, we can actually see some outcomes for those communities.
Just on that point, Veronica, are there any general comments you'd make to, say, people from the health sector or other sectors about how to go about those sorts of engagements?
I think the idea within the project is really to get these experiences, join them up with the data, I suppose, that the health and environmental stakeholders understand, to bring that human element, as Melissa was just pointing out, to what people are experiencing, and bringing them together with community to really talk through what is possible within the realm of the resources that are available. So the key thing with these local community resilience plans is that there'll be a range of strategies. One, at one end of the spectrum, ideas that are manageable and can be achieved within current resources. And then there'll be others sort of up the other end of the spectrum, which might take a bit of time and a bit of lobbying for extra resources. But I think it's important that those smaller manageable strategies, which are the ones that we hope to implement within the project timeframe, will then, spur on, the will and to tackle then the sort of larger strategies. So that's the idea behind these systems workshops with stakeholders, is really to come up with a plan that covers all of those sort of complexity of ideas, and having those small wins to really generate the confidence to tackle the big issues. So hopefully the stakeholders will be convinced through that sort of process.
Great, thanks, Veronica. Jo, you had a question as well?
Yes, I was really interested in the case studies. I'm sorry if I missed it. I wasn't quite sure from what Jess said how the data had been collected to assemble those case studies. Does anyone know that? Is Jess still with us? I think she's had to leave.
Jess might have had to leave, but Jeff might be able to answer that.
Yeah, Jess had to add another appointment she had to get to, so she gave her apologies. But look, Jess is based in Dubbo. She's a regional project officer in our team. She spends a lot of time in the field working with people. So a lot of what Jess is sharing, it comes from experience, and she's just really good at talking with people and getting their experiences out, getting people to share their experience. And so it hasn't been through a semi-structured qualitative analysis or anything like that. It's just really, these are just case studies built on experiences that she's come through. All those photos are photos that Jess has been taking in her time in the field, and her work either directly or with some of our other public health unit teams around in Jess's case, northwestern New South Wales, but we've got other regional people based in other parts of the state. So Jess is probably talking mostly from her experience and her discussions with other people's experiences.
Jeff, do you want to just mention briefly, that's sort of within the context of Housing for Health that New South Wales run?
Oh, okay, yeah. I should mention, so we run a program in New South Wales Health called Housing for Health. We've been running it for about 20 years. We use a standardised, repeatable survey tool of houses. We have a policy of no survey without service. So we have toolboxes with us, and we have trades, plumbers, electricians attached to our projects. So as we're going around houses, the beauty of the project is that we employ local people to work with us and train them to do the survey. So we get into 95% of the houses as we're doing the survey. We talk to people in the house, as well as test and measure and record everything in 300 items in the house as to whether it's working or not. Everything from, as Jess put up the pictures of the stove, how many hot plates are working, is the oven working, right through every test, every power point, every light switch, every drain, every tap, all the what we call the health hardware, the hardware in the house that impacts people's ability to live a healthy life. So can they wash clothes, bedding, remove waste? Can they prepare food? But also, we also record the temperature inside and outside of the house, and is the hot water system working? Is the solar, if there are solar panels, are they working? That kind of stuff. So we've been collecting this data for 20 years. We've got 300 or so data points, and on 4,000 houses across 20 years. So there's a lot of information there, but quantitative information. But in the process of doing it, which I think is more important, the process of actually being in the house and talking with the tenants and testing their fridge and talking to them about why we're testing your fridge temperature and how you should manage your fridge and food storage, etc. That process is really important. and also listening to people, of course, is listening. That's the key thing, is in hearing from people. So we, and on top of it, we've also run on the back of those housing health projects, because we find working with people in community, there's initially there's a level of distrust if they don't know you, and also a kind of a pretty, I'd say, pretty fair level of cynicism when a government program comes in. So until we actually start working and the trades start following along behind the survey teams, fixing all the things the teams found wrong, putting in new stays, replacing hot water systems and stuff, at that point, it's kind of like a honeymoon period with the community project, and then people start to say, oh, okay, stuff is actually happening, and there's, and then people open up and start to share some of their other issues with you. Okay, so, well, it's actually the housing is important, but what about, what are we going to do about this and the dust storms and those experiences that Jess was sharing about, what the dust storm might mean to someone. On the back of that, we've also run projects around pest management in housing, with, not just, mice, well, not just mice at the moment, but, just vermin generally, and cockroaches and stuff, and even bed bugs. And we've run projects around animal waste management, improving waste management in houses, and people often can't get rid of, they're saying, oh, this is great, but I've got, 2 old mattresses in the backyard and five old washing machines I can't get rid of because I don't have any bulk waste facility like you do probably in Sydney or Dubbo or Lismore or somewhere, So there's been a lot of, so we run a lot of other projects. We also run animal health projects. So looking at, working with the RSPCA and the communities to check animals and desex them and treat them, and also in some cases take samples of ticks and things from them and send them back for analysis to collect information. We've identified Q fever and other things in some areas. So a lot of that's information we've just sort of been working closely with the community. So I guess, so yes, her stories are a very long answer to your question, but her stories are, her case studies from her recordings of people's experiences through a lot of the projects that we, and particularly Jess, has been running in Western New South Wales.
Thank you.
Thanks for that, Jeff, and thanks, Joe, for the question. So, look, we've reached 5 o'clock, and I'd just like to really thank Veronica and Jess and Jeff for the presentation today. And I think it's a great illustration of really some exciting possibilities for Aboriginal-led adaptation strategies for climate change that places, traditional knowledge is at the centre of these adaptation strategies and actions. So hopefully that's the way that we're going to move forward into the future. And good luck with your project, Veronica, and good luck with the work, Jeff and Jess.